Serious, men of Reddit, what are some questions you have regarding women's anatomy? Do women on the internet genuinely enjoy their breasts bouncing, failing around and free, or is it an act? My GF insists it hurts and girls are just faking it. Trust your girlfriend. Attention. Serious, tag notice, jokes, puns, and off-topic comments are not permitted. https://www.reddit.com/r/creddit/wiki/index#wiki_rule_6, in any comment, parent or child. Parent comments that aren't from the target group will be removed, along with their child replies. Report comments that violate these rules. Posts that have few relevant answers within the first hour, and posts that are not appropriate for the serious tag will be removed. Consider doing an AMA request instead. Thanks for your cooperation and enjoy the discussion. I am a bot, and this action was performed automatically. Please contact the moderators of this subreddit /message/compose/question mark 2 =r/askreddit if you have any questions or concerns. Does a guy hitting on you become immediately creepy if you're just not attracted to him? If not, what is the line in the sand where an attractive guy's flirting becomes creepy? I ask, because I was thinking about this from a guy's perspective the other day, and am curious. Not for me. It's only creepy if he continues to try after I've told him I'm not interested. Same for the attractive guy. If I'm not interested and I say so, stop. Fuck it, I'll step up to the plate. Vaginas seemed messy to just have. It's an open orifice with direct access to layers of cotton and denim. I know my penis can occasionally get messy, and it's a much smaller orifice. Does this lead to any issues that the average guy wouldn't think of? It's not like an open gash wound, it's protected by the vulva. Think of your asshole as the vagina, and your butt cheeks are the vulva surrounding it. It's not like your asshole is directly rubbing against your underwear all day. Hopefully, that was a good Eli 5. Do you girls randomly get moist? As a man growing up, bonus can come random as hell sometimes. Curious if that happens to women. Yes. I'll be standing up and having a conversation with someone and I'll feel a bunch of liquid exit my vagina without warning. Super strange feeling, and I have to act like it didn't happen. I always mentally freak out that I've started my period, even when I'm nowhere close to my cycle being ready to start. Are the fun game of discharge, sweat, or period? Is it possible to lactate without having been pregnant? Yes. It's called galactorrhea. I don't know that it's super common, but it is possible. Do women get the pee shakes? As in after urinating sometimes feeling a shiver go up your spine, not like in a pleasurable way though. Oh yes. I love the pee shakes. I've never had this. Wonder how much I'm missing out on here. What does it feel like to be pregnant? I mean physically. It's one of the craziest thing a female body in most species does. You know that chest burster scene in the original Alien? It's like that, but lower. Seriously though, pregnancy can be both joyful and a major league pain in the ass at the same time. It's amazing to feel the baby spin around, but it's also goddamn fucking annoying when they decide to use your bladder as a trampoline, or when baby decides they need to stretch and shove your ribcage out of their way. It's a huge amount of stress, emotionally and physically, on the body, and, to this day, I don't think society as a whole still really appreciates it. I had no morning sickness, but I did deal with gestational diabetes, preeclampsia, and a baby that sat on my sciatic nerve for 6 months. I hated the lack of mobility when I was further along, the inability to get comfortable when I slept, and I was always burning up hot. I love that you likened it to Alien. That's what I always thought of when I felt the baby move. Less about actual anatomy, but why would they want a human being growing inside them for 9 months? That sounds horrifying, plus knowing what giving birth is like. I would be like, get this thing out of me. Giving birth is, literally, just. I can't even describe it. Pregnancy, for me, was hell on wheels. I was sick all the damn time, was on bed rest, had induced labor that still ended in an emergency C-section. My cousin has 3 kids and none of her labors lasted more than 4 hours, and didn't have to push more than 3 times each. It's a crapshoot. But there is something magical about feeling that wee alien growing in your belly and rearranging your insides, doing jumping jacks on your bladder. But would I do it again? Oh, fuck no. My wife and I have 2 kids. The first time, my daughter was easy for her, or at least, easier than my son was. She had morning sickness for the entire pregnancy, she was puking as he was born. Then the vomiting stopped. After that, she said she never wanted to be pregnant again. How much does abortion hurt physically? Are there any potential negative side effects with regards to fertility? How about the morning after pill, is it completely safe to use as often as needed? Also, what's your preferred method of contraception? Those of you who are taking the pill, aren't you worried about how it affects your libido and possibly other aspects of your relationship? I've never done it, but the impression I have is, it depends. It depends on the specific woman and how far along she is, and of course what sort of abortion method is being used. I know it was described as something like worse than normal menstrual cramps for someone who was only like 3 months along. My preferred method of contraception is being ugly. You ever have a fart bubble travel to the front and tickle your sensitive bits? I know it's funny, but I seriously wonder sometime. Yes, often enough that people name the phenomenon. In a recent thread I learned that this is called smoking the salmon, the cat slapper, or my personal favorite, exiting through the gift shop. Flatulence. Why would you put up with all the symptoms of periods, bleeding, cramps, headaches, etc.? How have you not already voluntarily taken steps to remove that forever? I guess as someone who has never wanted kids, this is easy for me. Is there any way to prevent that temporarily? We can take some birth controls to stop periods, but there are a lot of hormonal issues that can come from that. Believe it or not, most doctors won't perform surgeries to stop all that. Especially for young women who don't have kids. Some even require their husband's permission before they perform the surgery. Greater than some even require their husband's permission before they perform the surgery. It really pisses me off that this is still a thing. This may be dumb, but how bad does it hurt to be kicked in the crotch? For me, being kicked in the balls is like 7/8. I remember falling and hitting myself there as a kid. It was more of a pelvic bone bruise than a sensitive organ thing. Which is more sensitive sexually, nipples or clit? For me, the nipples enhance the sensitivity of the clit. I haven't orgasmed from nipple play, although some women can. But I will definitely feel a much greater sense of pleasure if my nipples are played with as well. Some women are put off by nipple play though, so ask first, does a healthy labia chafe? I imagine it would be very distracting. Sometimes yes, if you wear the wrong panties or pants that don't fit right. Is there a specific window of time when you can get pregnant, or is it just whenever? Well, it's hard to tell when you're ovulating. You can make assumptions and track your period and body temperature and vaginal discharge and stuff. But that's no guarantee. Some women can tell when we ovulate, the discharge gets more egg white consistency, body temperature spikes, and I personally get very aroused for a day or two of the 3-day window. Why do you squirt? Is it natural or just porn stuff? I have heard of women squirting, but I've never experienced it before. This isn't exactly an anatomy question, but it's been bugging me for a long time. So when you wear sleeveless dresses, like the ones that don't have sleeves or straps or anything, how does the dress stay on you? They squeeze you, plus most have an elastic or rubberized top band along the neckline that is grippy, for lack of a better term. Kind of like how your boxers stay on. Or your socks stay up. What does squeezing her boobs feel like? Give the fatty part of your butt a squeeze. Sort of like that. It's pretty much just squishy tissue. But with less hair. Do boobs hurt when you're menstruating? They can do, not for all women though. A lot of women experience breast tenderness during periods, myself included. Symptoms vary from woman to woman. Like some women get really bad menstrual cramps, some women don't. Yes, they do for me. Very tender, a slight breeze hurt. Specific-ish question for any woman with experience. I was seeing a girl who got diagnosed with thyroid cancer and she had it removed, partially. The whole experience changed her and she ended things because of how she was feeling from the whole situation. Does anyone have experience on what the removal of a thyroid does to a woman? I would really appreciate some insight because it's been tough trying to understand what she is going through. I obviously respect her feelings and don't want to encroach on her space, but it's just been tough trying to wrap my head around the situation. P.S. I feel very selfish/guilty making this seem like I am the one going through something when she is the one who is going through something major. I haven't had my thyroid removed, but I have had times in my life where my thyroid hormones were low. It causes the entire metabolism to slow down. There's no sex drive. Your energy is basically at zero. There's also depression that comes with the metabolism stuff. And to top it all off, you're putting on weight, your hair starts falling out. There's an entire body image thing you're dealing with. It's a rough ride. I've had thyroid cancer and my thyroid removed, and all this is true. While I didn't require chemo or radiation, thank God, the 9 months or so after surgery are kind of hellish and do make you sick. The doctors start you out with a very low thyroid replacement medication dose and then incrementally increase it over time to get to the right dosage. That means for months your body has hypothyroidism or low thyroid. You are sick, depressed, sluggish, brain fog, cold all the time, dry skin, thin hair, clumsy, low libido, weight gain. The depression was honestly worse than the initial experience of cancer and surgery for me. It's nasty. And on top of that I was dealing with a huge trauma of even being diagnosed with cancer at all, which is terrifying. It knocks your whole life off kilter, you reevaluate everything, you have to face your own mortality, all while dealing with whatever horrible treatments and side effects you have to endure. Try not to take it too personally. When I was in that awful place, it was hard on my husband. Maybe she is going through depression and physical trauma and just wants to spare you the details. Maybe she doesn't have enough energy left to put into a relationship. It's a terrible thing to go through. But don't take it personally even if it hurts. Edit to add, thyroid cancer also happens to lots of men. So I would chalk her personality changes up to the cancer, not necessarily her hormones. Being hypo-T is just lousy as hell no matter who you are. How much work actually goes into maintaining a healthy coochie? Like for guys it's just basically give it a clean while showering and don't stick it in machinery, but it sounds like a full-time job for the ladies. Nope, pretty much the same. The vagina is self-cleaning. The biggest thing to remember is to not use any chemicals inside, including douche, and to pee after sex. Other than that, throw on some cotton undies and always wipe front to back. Yes. Just to add on to this, a lot of products that are specifically targeted for coochie cleaning are BS and exploitative, summer's eve, looking at you, at best, and often actively harmful. The thing I will say that makes it maybe a little harder is that, in addition to what I just mentioned, there are things that can be bad for your little ecosystem. Bath bombs are a common culprit, and, like, flavored condoms should never go in there. Edible undies are a little sus also. I'm sorry if this is grossly offensive, but I have been curious about this since I was a child. How do women with the combination of very wide hips and extremely wide bottoms use the toilet, and how does cleanup work? Do the cheeks stick out to either side or just sag down over the sides? Are you able to sit normally or do you have to squat or something? Again, I'm really sorry, and if this is too inappropriate please tell me and I'll delete. We can sit on the toilet and wipe just as good as you can. I can't speak for women with implants though, that might be something they'd have to get used to. Though we all have to squat when peeing behind a bush. Can you use your vagina as a fleshy pocket or pick things up with it? While I personally don't store things in my vagina, I have used Kegel beads to strengthen the vagina walls. I've also heard of women who can throw darts with their vagina, but that was in Thailand. I'm not that talented. Girl, you are the MVP. I see you responding to all of these questions, Lamar. I guess this is more of a sex ed question, but if a woman is taking contraceptions like the pill or implant or something, is it okay to have unprotected sex with her, or should one still wear a condom if they don't want to get pregnant? No contraceptive is 100%. Most are in the upwards of 99%, but there's always a risk. While the pill and implant are good, if you miss a dose or you take antibiotics, you will cause them to not be as effective. IUDs are also good. They also don't prevent STIs, so unless you're in a monogamous relationship and have both been tested, use a condom. Even those aren't 100% and don't always protect against things like HPV, genital warts or cancer, and HSV, herpes. My recommendation, always use a condom. Just adding for those who don't know, the pill's effectiveness is based on being taken properly, including taking it at the same time each day. If your pill is a chewable that you can't drink water for 10 minutes after taking and you don't chew it well or drink something, you reduced its effectiveness. Etc. etc. I always recommend a condom if a woman is on the pill, unless you're fine with an accidental pregnancy. The effectiveness rate when taken properly is high, but much lower given how most women take it. I'm a big fan of hormonal IUDs and implants, by far the most effective and nothing to mess up unless you don't get it replaced. Do you like it when guys touch your butt when hooking up? Or is it more of a thing you just let them do cause they like it? Obviously I mean consensually. That would totally depend on the woman. How deep is a vagina? Are they all the same? Vaginas can be different in depth and width. It's a myth all women want a 12-inch penis. Some of us could never comfortably fit that in, let alone enjoy it. So never feel insecure about the size of your penis. There is a very good chance that there would be a woman who would find your size just right. Cool, this nice, wish school was like this when I was a young man. Thank you. I got to, what exactly happens when a woman climaxes, and does it hurt for more endowed ladies to lay down on their chest? No clue about what actually happens, but it essentially feels like a burst of euphoric physical pleasure that starts at the clit and goes throughout my entire body. And then I want a nap. That may just be me though, woman shrugging.